And we are doing oral histories for the upcoming exhibit, Celebrating Nursing in the Upper Cumberland, and that is opening on March 30th, 2019. Hello.
Hello.
Thank you for coming in. Just for the record, what is your name and hometown?
Betty, Brotherton in Cookeville, Tennessee.
Right. Thank you. How long have you been a nurse, Betty?
44 years.
Oh, goodness.
Yes.
Tell us about your nursing profession a little bit. Tell us
Okay.
about your background and how your career started and how it progressed.
Okay. I went to LPN school, which was a school out of Nashville, and I was penned in 1961. And then I started working at the hospital, which was Cookeville Regional Medical Center now, but it was Cookeville Hospital then. And I worked till 62. And then after that, I started working for Dr. Francis in 1962 and worked till 1996. And that's when he passed away.
Wow, so you worked all that time for the same doctor.
34 years.
Now, when you say you got pinned, can you explain to the people out here that may not know?
Okay, pinning is when a nurse graduates from nursing school. They give you a pin that you wear on your collar.
Is it your school pin?
It's your school pin.
Okay, okay. I think that we'll have some of those in the exhibit. So
okay,
that'll be cool.
And then after Dr. Francis died, I started working for Cookeville Medical Center, which Dr. Jane and other providers were there at that time. And I worked 9 years there, from 97 until 2006. And then I worked as a medical coordinator of his office. I helped, run different parts of the office. And then he wanted me to go to a medical practice management school. So I did, and I became a CMPM, which is a Certified Medical Practice Manager. And that was in 2000. And then I did ACE programs after that to keep it up. And it was a school out of Knoxville, I said, is the Tennessee Doctors Management School of Medical Practice. And it was very interesting. We went several weekends, to do that.
So then you managed the
office.
Okay, okay. Well, that's
the medical part. Then we had somebody to do the business part. And he had a big practice. And so it was quite challenging at times, going from a private practice to a multi-practice,
Well, and it really illustrates how many different facets there are in nursing and how so many nurses' careers take an avenue that they never imagined taking.
Right.
So I don't know if that girl who was standing there getting pinned would have thought, I'm going to be managing this large practice.
Right.
Yeah.
Yes. That's true.
So what to you, Betty, were the best and worst parts of nursing?
Okay, the best part is patient care. I love to be with patients and interact with them and their families, and you learn to love each person in different ways. And we learn about their health and their lives, and it's just a good hometown feeling. That's what I like about it. And also seeing patients in town, they'll say, well, how are you doing? And we'll talk about their families, and they'll talk about my families. The children would run up and hug me, and they'd say, oh, you and Dr. Francis made me so much better.
Oh.
And that's sweet. And so it's been 23 years since Dr. Francis died. And so it just only seems like yesterday.
Yeah. I know he made a big impact on a lot of people's lives around
here.
here.
He did. Oh, a lot of people.
Very well loved.
Right. And the patients would say how much they miss us,
Yeah.
And we had a great working group. There was 3 of us and then him, 4. people in the office. And then I went to work for Dr. Jane, and I bonded well with him and his families and his patients. And they'll ask me today when I see him on the street, now where were you practicing? And I'd say Dr. Jane, you know. But it's just, he had several people, a large staff, and it was just wonderful memories of all nursing careers.
That's so nice. It really does. It becomes a family, doesn't it?
It does, yes. Yes, you become involved with them.
Mm-hmm.
Now, the worst part was the loss of a patient, you know, when a patient died, or when we had to tell somebody that they have an untreatable illness.
Mm-hmm.
And it was heartbreaking. And the long hours, I'd say that's part of the worst.
Yeah, that's kind of a hallmark of nursing, isn't it? Long hours.
It is.
Yeah.
It is.
Straight across the board.
Right.
So what are the biggest changes you've seen since you started?
Okay. In the nursing uniforms, we wore white dresses, then we went to white pantsuits, and then we went to scrubs of multiple colors.
Mm-hmm.
And we had to wear our hair short and not on our collars. And you know, we were very, I guess when we first started, we were very starchy, but now the nurses have gotten very more casual.
Mm-hmm. More comfortable.
More comfortable, I would say. That's true. Then we, when we first started, we did vital signs manually.
Mm-hmm.
And, you know, oral thermometers in your mouth, the mercury. I'll tell you a cute little tale on that. I had this man, put his thermometer in, and I said, now, I'll be back in about 5 minutes. If I'm not, will you lay it here on the desk for me? And he said, okay. So I've gone a little bit longer. When I got back, I looked at the thermometer, and it said 104.
Uh-oh.
I said, oh, my goodness, Bill, what's wrong with you? And I felt of his head, and he giggled, and he told me what he did. He just put a match under it.
Oh.
So anyway, we had a lot of different funny things like that happen.
Yes.
And then we had paper charting, and we had to document everything. Very important. And if it wasn't documented, it wasn't done.
Yeah.
That's true. And then we started having all these different regulations that we had to do.
Mm-hmm.
The HIPAA thing, which was Health Insurance Proprietability and Accountability Act. And that is the Privacy Act. You know, where you sign the paper saying that you give so-and-so, my husband, what's his name, the right to call.
Right.
Or what. And it's really a good act.
Yeah.
Very private. But in nursing and being in a doctor's office before this came into effect, you told nobody anything. You know, it was there.
Yeah.
And we had new guidelines. We adapted well to them. We went to meetings to learn the different aspects of the Privacy Act. And that was in 1996.
Mm-hmm.
Then we had to do safety data sheets. And we did this in 1993 when it became effective. That means that everything that you had in your office that was liquid, powder, paint, or gases, even the whiteout that you have in the front office, it had to be screened to see if it was fire, chemicals, electric, or environmental. And you had to keep a record of this.
Wow.
Yes, it was a lot of record keeping.
Yes, it sounds like it.
And
You
then
have to be very organized.
yes, you would. And then OSHA became in 1970, which is Occupational Safety Health Administration under that program. And we had to keep up with injuries on all office personnel. We also had to have red biohazard cans. I guess you've seen those in the office.
Yes.
We had the sharp containers where you put your needles or blades, knife blades. And then we had to have safety syringes that would, when you gave a shot, that would or an injection rather, that would retract back up into the syringe,
okay.
so that you would be less likely to get stuck.
Mm-hmm.
But if you did get stuck, I have things for that too. Also, we had to have the mask with the eye shields because of the splatter.
Yeah.
When you were doing certain things, which is very important. Now the sharp injuries, I'll talk a little bit about that. If you were treating a patient and you got stuck by their needle some way, then you would explain to them the process and the procedures that we go through to make sure that their personnel is safe and that they're safe. And if you had to draw blood, and it would not be a charge to the patient or to the personnel. And this screens for HIV, RPR, which is syphilis, and hepatitis profile, and herpes simplex, or the virus. Just they just draw a tube of blood, they send it to the lab, and then in 6 months, the employee or nurse or lab technician, whoever got injured, would have another test, the same thing, and then again in another 6 months. And then they said if the doctor wanted for them to have a test or recheck in a year, then they could. Mm-hmm. And then we had to do an incident report telling where they were injured, how they were doing, what kind of syringe or knife blade or whatever they were using injured them. Mm-hmm. Then we did next we had to plan a safety exit, which means gun control, a fire safety, where to go, where to meet outside the building in case there was a fire. We also had to have a fire drill to implement this. Then we would have storms, and you would have to know where to take the patients or the employees down to the lowest unit of the building. Then the newest thing, which I liked the best, was the computer charting. The providers didn't care much for it, but you could read their orders, and it was really a great thing. And you could keep up with medication and vaccines. And then we did vital signs, which were electronics vital signs. Also, I went from a single practice or private practice to a multi-practice. And then I guess one of the newer things was the telephone. I always liked somebody to answer the phone. But now we're gone to computer phones, we press 1 for this, 2 for that. And,
right.
And older people have problems with that.
Yeah.
But truly, I've enjoyed being a nurse.
Well, it sounds like you've had a really good experience with a lot of different aspects of nursing, which is really cool to hear. I've heard several different, we've done several different oral histories, and it's been really interesting to think about all the different aspects that there are to nursing and the different ways that you can go out in that career. So thank you so much, Betty, for coming in today.
You're quite welcome.
Thank you for helping with our exhibit.
All right. Thank you.